The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you so much for joining us today on our webinar, The Public Charge Rule, what it is and how it's going to affect children and families. So I'm Pip Marks. I'll be hosting the webinar today. I'm the Project Director for Family Voices of California. And before I introduce our wonderful speakers, I'd like to tell you just a little bit about Family Voices and the work that we do. Sorry, I'm just trying to get over to my screen so I can. So we're a statewide coalition of locally based parent-run centres working to ensure that children and youth with special healthcare needs receive quality healthcare. And as the state affiliate of National Family Voices, we are California's federally funded family-to-family health information centre, and we provide statewide support and resources to families of children with special needs. Our webinars serve as statewide trainings, and as in this case today, a nationwide, on various child health related topics and are geared towards families, professionals, advocates, and parent-to-parent resource staff. If you have any technical difficulties during the webinar, you can call the GoToWebinar number you see directly on your screen. And due to feedback issues, we have everybody on mute from our end. Throughout the webinar, feel free to type in your questions on your menu in the question box on the right-hand side. We'll save time at the end so Kacey and Emily's presentation for Q&A. And today's presentation is being recorded and will be posted on our Family Voices of California website in a couple of days. And after the webinar, you'll be emailed a very short evaluation survey. And we thank you in advance for taking time to give us your invaluable feedback. It's really important to us. It's now my pleasure to introduce today's speakers, Emily Reece and Kacey Wulff. Emily is the Children's Movement Coordinator and Database Administrator. She is their systems guru, where she manages technical platforms including Salesforce, MailChimp, FormAssembly to scale the movement. Emily is always looking for ways to more effectively engage members and improve time-consuming tasks for the team by implementing new functionality, tools, and automations. She is also a trusted communicator for the children's movement's advocacy campaigns. Emily first joined ChildrenNow as the Special Assistant to the President, supporting the President by assisting with administration, communications, and project management tasks. Prior to joining the organization, Emily worked at the as a special events coordinator at the Gold Arrow Camp in Huntington Lake, California, and taught English in Yokohama, Japan. Emily has a bachelor's degree in political science from the University of California, Berkeley. And Kacey is the director of the Children's Movement, which is a statewide network of pro-kid business, education, parent, civil rights, faith, community, non-profit organizations that want to make kids the top public policy priority. And prior to ChildrenNow, Kacey served in the Obama administration as the Director of Outreach and Enrollment at the UC Department of Health and Human Services. There, Kacey worked to implement the Affordable Care Act and lead efforts across policy and external affairs teams to develop and implement strategies to drive enrollment on healthcare.gov. Kacey also served as a policy advisor and special assistant in the Office of the Assistant Secretary for Preparedness and Response, where she responded to natural and man-made public health emergencies. Kacey publishes, presents, and teaches on the intersection of health disparities, public policy, and community resilience. She has an MPH from Johns Hopkins Bloomberg School of Public Health, where she was awarded the Summer Scholarship for Leadership in Public Health, and she has a BA in Philosophy from Stanford University. Emily has been recognized as a Fellow in Bioethics at the National Institutes of Health and a Fellow at the New Leaders Council. Congratulations, both of you. It is now my pleasure to hand the presenter role over to you both, and thank you so much, Emily and Kacey, for doing this for us.
Thank you so much for having us, and thank you for that very kind introduction. But more than anything, thank you for what you do for kids across this country and how you help represent their interests and give opportunities for us to share what we think are exciting opportunities for action. So thank you so much. So as Pip mentioned, I'm Kacey. I'm the director of the Children's Movement, and the movement is a network of people and organizations that simply put care about kids. And what we try to do is invite everyone to the conversation on how we can make a difference in public policy. So our strong belief is that the people out there every day serving kids and families need a way to make sure that their voice can be heard in these big policy decisions. And that's what we're trying to do. We're trying to give people those tools and information, and what we want to talk to you about today. So today we're going to talk about a new proposed immigration policy. Sorry, just figuring out my screen. We're going to talk about a new change to an immigration policy, and we're going to share the basics on what it is, and then also we're going to share some of our concerns about how it might impact kids in particular. During this, at the end of it, we're also going to share some links and some additional resources if you want to learn more, but please feel free to open up the link that we are going to post in the comment section right now if you guys want to be looking at that at the same time. So as I mentioned, the movement, we're a network. We want to connect people to take actions to benefit kids. We have about 3,000 members, primarily based in California, but a few national members too. And we just pulled a little sample of them so you can see that you guys are in great company of just wonderful advocates who work tirelessly to make a difference for kids. I think many of you are already movement members, and if you're not, feel free to check us out or let us know. We'd love to have you in our network. So now I'm going to kick it over to Emily. As Pitt mentioned, Emily runs and operates our campaigns, and this is a really important one. So thank you for joining us to hear about how you can get involved.
Thank you, Kacey. Hi, everyone. This is Emily Reece. As Kacey mentioned, I'm going to do a brief overview of what is known as the public charge test, how it stands today, and also what the proposed changes are to the test, and then finally, how we expect these changes to affect kids and families. And spoiler alert, it's not good. So next slide, what is the current public charge test? So the public charge test is actually not new. It's been a part of immigration policy for over 100 years. It essentially allows the government to identify individuals that are completely reliant on the government for their livelihood, specifically individuals that are applying for green card status. So once the government determines that an applicant is considered a public charge, they weigh that status in the overall decision to grant that person a green card or not. So right now, the programs that can classify an individual as a public charge are really limited. They only include things like cash assistance or government-funded institutional long-term care. So on October 10th, the U.S. Citizen and Immigration Services proposed to broadly expand the programs that are currently considered a public charge. So rather than just those two limited programs I mentioned before, this new rule would expand those programs to possibly include things like non-emergency Medicaid or Medi-Cal if you're in California, SNAP, formerly known as food stamps, low-income subsidy for prescription drug costs, and even housing assistance. So those are the proposed changes. Like I said, they were released on October 10th. The rationale behind these changes is that the term public charge, although this test has been a part of policy for over 100 years, the term public charge has not been very clearly defined. We should also mention that there are a few exceptions to the rule. So certain groups of immigrants, including refugees, asylees, or individuals applying under the Violence Against Women Act, will not be included in the proposed changes to the public charge test. We know many of you work with immigrant families, and so it's important to know how this rule change would impact the communities that you're working with. And we also have more information about these groups if you're interested in learning more. So now, what's going to happen if this rule is finalized? So the proposed rule would affect millions of kids and families across the United States. In the U.S., 1 in 4 children has at least one immigrant parent. And in ChildrenNow's state of California, that number is nearly 50%. So nearly half of our children live with at least one immigrant parent. To be blunt, ChildrenNow and the children's movement, our take is that this new policy is essentially an intimidation tactic to scare immigrants away from seeking supports that not only help them meet their basic needs, but also many of these programs, specifically Medicaid, have actually proven to lead to self-sufficiency For example, if an immigrant is seeking employment opportunities but is prevented from finding a job because of asthma symptoms, they need to seek medical care in order to treat those asthma symptoms and eventually find a job. And that's where a program like Medicaid comes in. It provides those supports to help them eventually become self-sufficient. And as I mentioned earlier, the whole original purpose of the public charge test is to identify people that would become completely reliant on the government for their livelihood. And these programs that the new rule would expand to do the exact opposite. They help folks become completely independent. Also, perhaps the most alarming statistic, in California alone, the uninsured rate among children is expected to jump from 3 to 8%, which doesn't sound like a lot in terms of percentage, but with a population the size of California, that could be upwards of 600,000 kids in California that would stop seeking Medicaid services out of fear that it could cause their families to be split apart in this country. The bottom line is that the proposed changes essentially force immigrant families to make an impossible choice between meeting their basic needs and keeping their families together in this country. So now I'm going to pass it off to Kacey to talk a little bit about the process in which this whole change has been proposed and what you can do to take action.
Thanks, Emily, and thank you for that really great overview of the substance of the policy and just explaining what our concerns are by this pretty significant expansion of who would be implicated by this. So many of you have backgrounds in federal advocacy, but just to share a little bit about what the process is, when a federal agency proposes making a significant change to a rule like this, they have to publish what they propose the change to be. That's why we're calling it the proposed rule. And then that's open for a 60-day comment period. By law, they have to let the public comment. And I want to make sure to emphasize that when we say the public, we mean anyone. There's no age restrictions. If you work with students, students can make comments. There's also no documentation restrictions. If you work with undocumented families and they want to talk about what difference these programs make in their life and have their voices heard, anyone can submit a comment. Any member of the public, any organization, any institution, any person. My mom submitted a comment last night. You know, truly anyone can submit comments. What happens when the comments are submitted is then the agency that has proposed changing the rule has to review every single one of them. And when they publish the final rule, when they finalize the rule, they have to address the concerns that were raised. So in their justification, and they'll publish a justification with the final rule. So this is a very powerful process to make sure that everyone's voice is heard. It also just shows how important it is to engage as many people as we can, because we have very serious concerns about what the impact will be on the families that we all serve every day. And we want to make sure that we hold the agency accountable for addressing those concerns. So the sheer volume of comments is also really powerful, because then they have to address the concerns that are raised. So that's a little bit about the context. It was, as Emily mentioned, the proposed rule was published October 10th, which means that the comment period is open until December 10th, which is Monday. So, the thing I really want to ask is that everyone listening to this consider submitting a comment. Tap into your own expertise and share your own opinion. You guys are all experts on these programs, how you see the programs changing the lives of the families, the kids and families you serve. You all have very deep expertise, and our ask to you is to share it. And we want to be your partner in that process. So we're standing by to be resources to you. The link you see on your screen, that if you click on that, it'll take you to a form that will give you more tips and tricks on how to draft a comment. The important thing here is that you put it in your own words and that you share your own perspective and your own expertise. We're happy to also help. If you want help drafting a comment, if you have a few ideas or some perspectives you want to share, we're standing by to help you with that drafting process, because our single greatest concern is that everyone has their voices heard. You guys have all already been very generous with your time in listening to this presentation. I think it takes less time to write and submit your comment. It probably takes about 5 minutes, realistically, start to end. So please click on that link. and begin drafting your comment and submit your comment. And then let us know how else we can help. If there are other people in your community that you want to engage, you want us to do a workshop, a webinar, you want to share our resources, we're standing by to help you. So please share this broadly and let us know what you need from us.
I also just wanted to add, I don't think participants are able to click on the webinar per se, but you can click on the link that Pip kindly shared in the chat. Also, if you have a smartphone, you can take a picture of this QR code on your screen and it will direct you to the form. The form also has a downloadable template that you can use to start your comment. And then on the slide on the screen right now, we've included a few more resources if you're interested in learning more about this policy before or after you submit your comment. And the first link is to a report published by the Children's Partnership and kidsdata.org. That's where we pulled that 600,000 uninsured number from if you're interested in learning more about Medi-Cal enrollment rates or Medicaid enrollment rates. Also, Protecting Immigrant Families is the larger coalition that has been organizing groups like ChildrenNow in this important effort, and they have a plethora of resources you can use to help spread information about this important effort. And I should also add they have lots of resources in both English and in Spanish. If you're a podcast listener like myself, This American Life, episode 656, Let Me Count the Ways, sheds a lot of light on this issue. It doesn't go into the public charge test specifically in that much detail, but it does kind of frame the context in which this policy is taking place. It talks a lot about similar proposed immigration policies that would have also harmful effects on families. So if you want to learn about the wider environment where this is taking place, that's a good resource. And then lastly, about a month ago, there was an op-ed published in the New York Times by a physician who works a lot with Medicaid families. And obviously he also believes that this new proposed change is just an intimidation tactic that forces families to pick between their health and keeping their families together.
Can I actually add one thing to that, Emily? I think that's so helpful to really pull these together. Your point that this is happening in a broader context is really important. And I think sort of in addition to the technical changes that we're worried about that would expand the programs that can be considered to deny green cards, there's also a broader culture that this creates. And we've actually already seen a drop in enrollment of services and access to services. Actually, I was reading a report showing that SNAP enrollment has gone down very significantly in the immigrant community. And it's because of a culture of intimidation. I was reading a report yesterday showing a decrease in kids showing up at school and school enrollment because of a culture of intimidation. And so I think sort of your point about the broader context that this is happening in is really powerful. And one reason why we're so really determined to help everybody add their voice to and their opinion to this policy is that it's one of the few tools we have to change the culture and to change the conversation that is already having an impact and a chilling effect on families. Emily?
So we will wrap things up with this slide. Again, as I mentioned, you can either take a picture of this nifty QR code with your phone or click on the link that Pip added to the chat section in order to submit your comment. Also, I included Kacey and my contact information. If you have any questions about how to submit your comment or how you can share this comment with your networks, we have so many resources that we are more than willing to share. So please don't hesitate to reach out. With that, we'll leave it open for questions.
Great. I just want to add a big thank you again to Pip. And we really appreciate your questions. We will do our best to answer them. And if for some reason we don't have the answer off the top of our head, we'll work with you to get you the information you need in follow-up.
Great. Thank you, Kacey and Emily. A couple of questions have come in. Can you expand on the potential effects of changes for immigrant families who have children or youth with special healthcare needs?
Absolutely. I mean, that's a great question. So my biggest concern, of course, are kids who have kids with special health care needs who are using Medicaid. So what the impact of this policy would be is if So Emily mentioned, half the kids in California have at least one immigrant parent. There's also a very large number of kids who live in mixed status families. And so what we're concerned about is that a parent who may not be documented has to make a set of choices about whether to enroll their kid who may be documented, or it depends on the state you're in, maybe legally entitled, legally allowed to use these services, but has to consider whether that puts them in a position of being penalized when they proceed in their immigration process. And so we're concerned that even the technical letter of the policy that wouldn't necessarily implicate that parent, it scares a parent into thinking that they might be denied in their immigration proceedings if they get their kids the help that they need. And, as that puts, any parent will do whatever they can to stay with their kids. And so I think our biggest concern is a significant reduction in enrollment in Medicaid and just the vast implications, particularly for kids with special health care needs, of not getting timely services. And then also the financial protections that come with quality health insurance. So that would be our concern, specifically is a decline in enrollment in Medicaid because of the both potentially technical policy, but also the intimidation that comes with it.
Okay, thank you. Kathleen, one of our attendees, has just gone to the website to put in a comment, but she says it freezes at the point that they try to enter the comment. Do you have any suggestions?
Oh, no. We don't, but if you want, we can try. So if you want to send us your comment, we can try to enter it for you because on our end to see if maybe if it works better. But shoot, I would say maybe hit refresh. Let us know. Actually, let us shoot us your email and we'll follow up with you to make sure we can help you get it submitted because we definitely want to get it submitted.
Yeah, I have Kathleen. I can send that to you if it's. I'll email Kathleen and make sure that's okay. And what will happen? What will happen if the child is a citizen and disabled and the parents are trying to apply for asylum?
That's a good question. So if a child is a citizen, and in some states, even if they're not a citizen, they are able to enroll in Medicaid. The concern is that this is just going to scare the parents. And so technically, like under the letter of the policy, this wouldn't necessarily apply to them. We think this is primarily for green card applications. Asylum, we'll see refugees are excluded. I don't know if asylees are excluded. Okay, yeah, Emily's nodding. Asylees are excluded, but the concern is that this is going to scare parents into not seeking those services. But technically, no, they would not be impacted.
Yeah, I should also add the use of benefits is considered on an individual basis when the government is considering a person's application for a green card. So in theory, a parent who is undocumented, if their child is a citizen and is using these benefits, the child's use of the benefits should not be considered in the parent's application for citizenship. Nevertheless, a lot of times decisions such as healthcare are made not on an individual basis, but on a family basis when you're considering health for your children. Also, because it is such a dense issue, a lot of families weigh on the side of caution when there's any sort of gray area. So if you're unsure about whether or not your child's use of a benefit is going to affect your ability to stay in the country, parents aren't going to want to risk the possibility of being separated as a family. So as Kacey mentioned before, there is a chilling effect. And it's essentially an intimidation tactic that scares people away from even considering these programs because it's unclear sometimes if there's a risk of whether or not it's going to be considered or counted against them in their application for residency status.
I think it's also worth saying that, so in school enrollment, we're seeing a drop in even just parents enrolling their kids to school because they don't want to fill out paperwork about themselves, right? So it is potentially the impact on their immigration proceedings when they're at that stage, but it's also the immediate impact of a lack of trust and a lack of wanting to share family information in this broader, increasingly hostile climate on immigration.
Okay, so you may have answered this. Patricia's just asking for clarity around a point. She said if a parent is adjusting their status, applying for a green card, for instance, he or she doesn't need to declare if he asks for benefits because the benefits for the kid, not for the parent. Is that right?
That is technically correct, yes.
Okay.
Yeah.
Okay. And then Liz is saying, for children with special healthcare needs, does child participation in Medicaid, Medi-Cal count against the parent's application, which we kind of just answered, for green card or citizenship? Yeah.
Right. So the concern is, yes, technically no, but the concern is that we're just seeing families totally freaked out, right? And parents not wanting to do anything to jeopardize being able to stay in this country with their families. So that's really what our concern is, both the technical application of it, but particularly the impact on kids of having these parents just increasingly vulnerable and unwilling to, and not unwilling, but scared, and a lack of trust to be able to go and apply for these services, give their family information, and take those risks.
So can you, either of you or both of you, talk about SB4's, Ricardo Lara's bill, legislation that passed 2 years ago now, I think, the Health for All Kids, and how,
So I think, thank you for the question. What this policy change doesn't impact current state or actually federal health policies. The impact is on then who uses those policies when they apply for their green cards. So this wouldn't impact SB4. It wouldn't impact how that is rolled out, how that is applied. But what it would do is it would spook families and intimidate families who are now becoming eligible for health services that weren't eligible for health services previously into thinking that potentially if they take advantage of these expansions that they might be penalized later on down the line. So it's a great question, but no, it wouldn't directly affect any state or federal health policies. It would impact the people who use those policies potentially in their immigration proceedings.
Thank you. Carol is asking, what about parents who have U visas?
Oh, what a great question. I don't know that off the top of my head. Yeah, okay, let's, would you mind sharing your contact information with Tip or with us so that we can track that down and get back to you?
I will send the question to you and then forward it back to Carol.
Thank you, Pip.
And then someone's asking, are you doing these webinars and trainings in Spanish?
Oh, what a great question. I'm looking over at my colleague who's fluent in Spanish to see. Lucy, are we doing these in Spanish?
You do a webinar in Spanish.
We'd be happy to. We would love to. We have materials in Spanish that we can send over, and if there's a Spanish-speaking community that you'd like us to do a webinar with, we'd be thrilled. Okay.
That's all the questions that I have received. I give people oh, here we go. No, Raquel is saying gracias. Oh, Eileen is saying it would be great if you had a YouTube video to share with families.
Great.
Well,
we do. Emily, we do. Great. And then also, if there's desire for a Spanish YouTube video, we could also put that together. Just let us know. We're standing by.
Okay. And do you provide in-person trainings?
We have done that, and we're happy to if we're close to you. If we're not, then we're also happy to hop on the phone or do a webinar or really customize how we're working with you.
Okay.
The thing I'll flag is just I want to reiterate the deadline is Monday, and so it is really pretty time sensitive. So we'll do our absolute best, and we'll certainly tap into our team to make sure we're supporting you. But just let us know immediately so we can make sure we make you a priority.
Okay. Okay, Victoria has said that, just an FYI, U visas are protected, asylum status, and will not be impacted by this.
Excellent. Thank you for tracking that down. Really appreciate it.
And Maria is asking, if an undocumented individual has PRUCOL, I'm not familiar with it, PRUCOL, I don't know what that acronym stands for, which is Medi-Cal, what is their risk?
What is their risk? Let me repeat the question. So I think the question is asking, if somebody who isn't documented is using Medi-Cal or using Medicaid in a state that expands coverage to the undocumented population, what is their risk? So that's exactly what this policy would impact them. So what it would mean is that when that person is in their green card proceedings, their use of Medi-Cal could be counted against them and used as a justification for them being denied a green card.
Okay. And what are the next steps in the process for this rule? Where does it go next?
Excellent. Great question. So the next step is December 10th, the comment period closes, and then the agency has as much time as they need, frankly, to review the comments and publish their final rule. There is no regulatory deadline. Oh wait, Emily's pointing to me. Yeah, okay. So there's no regulatory deadline by which they have to publish the final rule, and so we sort of expect that with such large public comments, I think there's about over 100,000 that have been submitted nationwide so far, that this is going to be a long process, and the agency has discretion on what they do next. So because this is a regulation, it doesn't go to Congress. They're implementing a regulation. So what happens next is they review the comments, and then they publish their final rule when they are ready. And when they publish the final rule, they have to address the concerns that were raised in the comments in an explainer that will talk about how they considered the comments that they received. So what that means is, this is why it's such a powerful tool, is they have to reckon with and address what we raise as people who are serving these families directly, what our concerns are. So it's very powerful. It's a very powerful way to make sure your voice is heard and and engage in the policymaking process.
Great, thank you. Eula is asking, since pregnancy Medicaid is considered emergency Medicaid, will it not be affected by these proposed changes?
That's a good question. I think the answer is correct. It wouldn't, because this is for non-emergency Medicaid, but I don't know. I don't know for sure. So let us run that down so that we can confirm with you.
Okay, and I'm going to be sending you all these questions through the meme.
Perfect.
Okay. Liz has asked, can you just repeat which programs were part of the test previous to this change?
Previous to this change, it was primarily cash assistance programs, right? So it was basically like TANF or supplemental Social Security income. So it's primarily, basically the way that this has been used previously is very narrow. Really just immigrants who are using cash assistance programs extensively, it could be used. And even then, it wasn't that broadly applied. And I think that's sort of what the administration has said, which is why they're coming in to clarify, is that they want to clarify this further. And our concern is that the way that they're clarifying it just wildly expands the application.
Yeah. I just want to add to the long-standing public charge test that's been around for a century now. When the government initially created this test, they recognized that work supports like healthcare and nutrition help families thrive and achieve self-sufficiency. Right. So those programs were purposely excluded, and public charge programs were limited to things like cash assistance or long-term care, but not things like Medicaid or food stamps. And so if this rule were finalized, it would go back on that assurance that the government gave immigrant families for years leading up to this moment. So, it's just such a large reverse of our current policy too.
That's very well said.
I don't have any more questions coming in. Well, thank you. I'm going to be sending people's questions, the ones that were almost covered, to you both, and then you can answer them when you find out the answers, or if you could research the answers and find. Oops, hold on. Food stamps will be included in SSI next year, so that will fall under it anyway, right? That's what somebody's just commented on, made that comment. That food
That's interesting. Yes. Well, no, but food stamps, that's a good question. Food stamps has been articulated in the proposed rule to be counted, but your point is that it's the administrative, like including it in SSI would include it anyways. That's a really good question. Let us dig into that to get into that.
And this person, Christy's asking, she's just talking about California. She's located in California.
Okay.
I've had several people asking if they'll receive the slides. The slides and the recording will be posted on our website tomorrow, and that will be under familyvoicesofca.org. And you just go to our archived webinars tab, and you will see them there, so you can download them. Well, I think this brings our webinar to a close. Emily and Kacey, thank you both so much for this very, very important information.
We really appreciate it. And I'll just say, one last time, the comment period closes on Monday, on December 10th. So just so appreciate everyone's time, and please take a look and try to submit your comment today or over the weekend, because it really will close, and there's no way to stop after the comment period closes on Monday.
As long as the site doesn't freeze, right, as it did for Kathleen.
Yeah. Yeah.
So I keep people, as you say, refresh and just keep trying. Well, thanks everybody for joining us today. I really appreciate it, and we appreciate your feedback. So do us a big favor and fill out the survey when it comes into your email box later on. Okay, have a great day, everybody. Bye-bye.
Thank you.
Thank you, Pip.
Thank you.